to have Dr. Kureshi join us to discuss ear anatomy and ear pathology. If you're registered to this to the webinar, you'll be able to ask questions on the side. This webinar is recorded. It will be available for viewing probably tomorrow, and we look forward to Dr. Kureshi explaining ear anatomy and pathology in just a second. I just want to give you a quick introduction on the VetCAT. The VetCAT is a cone beam CT. As you can see on the screen, it comes to the patient procedure table, rotates around the patient once in about 30 seconds, and then the CT data is available within about a minute. We'll be looking at several of those cases. There's a number of users around the country. We have now hundreds of cases, a lot of dental use of the machine, but Dr. Kureshi focuses on ear anatomy in particular, a disease that we see quite a bit on patients who come to the dental office as well. So we'll be focusing on that a little bit. So that's the VetCAT. It allows you to diagnose, plan, and treat relatively quickly. And I want to immediately turn this to Dr. Kureshi, who is located on the West Coast. We're here at Xoran in Michigan, so it's dark and rainy, and Dr. Kureshi is in Cupertino, California, where he says it's sunny and warm. Dr. Kureshi, go ahead.
Well, good evening, everybody, and I appreciate you being here after a long day of work. We are going to be talking about the ears, and I'm going to start with the endoscopic view of tympanum, because anatomy is extremely important. Ear is a very complex organ. There are so many anatomy that makes it very confusing. So more we know about anatomy, better it is. So this is a view of transtympanic middle ear structure. So on the next one, these are all after removing the tympanum. These are all the anatomical structure you see. Getting more used to this kind of structure will make you read the CT much better. So this is a feline middle ear structure, and we are looking at through the tympanum. So the next one is the canine one, and we are looking through the ventrobula osteotomy approach. So you are looking at underneath. So the tympanum is on the roof of the image, which is attached to the malleus. Incus is all the way in the epitympanic recess, which is connected to the stapes right there. So that's the incudostapedial joint. Underneath is a round window, right underneath, promontory and the round window. Then on the right side, way far right in front of the malleus, tip of the malleus, is the eustachian tube opening. The little darker area. The darker area where the cursor is pointing, that is the jugular bulb. You have to be careful with anatomy when you are in the middle ear. And on the right side, far right side, are the spicules. So this is what you are going to see with the endoscopic view. Now, naming this structure on the next slide, these are all the anatomical structure that more you are more comfortable with, that more you are going to understand the CT. So these are all the different anatomical structure. David is going to put it on his website so you can have this slide for future reference. Now, looking at the CTs, we are going to start with the normal anatomical structure again. Here is the eustachian tube, which opens up gradually into the nasal pharynx that we are going to see it a little bit later on. And right next to that is internal carotid artery, which is very closely related to the eustachian tube in the nasal pharynx. So if somebody is trying to approach into the eustachian tube, you want to be very careful, because damaging the carotid artery is very, very easy. So the next section, next slide, has the anatomical structure of, let's see. Okay, so internal auditory canal that comes into the middle ear. So that's a view of the internal auditory canal on the CT. So the next one is the facial nerve. So the facial nerve is very, very important because that's what everybody wants to be careful about not damaging, because you don't want to end up with the facial nerve paralysis.
Let's see.
So it's the facial nerve that you want to be very careful about. Locating facial nerve on the CT during the surgery is very important. Sometimes there is a calcification built up, there is a mass on it. All those structures you can see on the CT very well. So the next structure is going to be, let's see. Okay, vestibular structure. So you want to watch the vestibular structure very well because that's where the semicircular ear canals are connected. When there is a vertigo or when there's a vertigo or the head tilt, quite often one of the semicircular ear canals is dehiscent, and there's a fluid that leaks out, so that causes the imbalance and the head start to tilt. Sometimes you have to go in there and fix the leak. Sometimes it will heal on its own. But knowing where the structure is, knowing where the semicircular ear canal on the CT is extremely important. It's very easily visual. You can see it very well, and we are going to see that in a little bit. So now, cochlea. Cochlea is connected to vestibular structure, and cochlea is connected to the round window. And that is very, very easy. It's promontory and round window, everything is all connected. So we will see all those structures right here. So this is a canine CT, and one side has a disease. So the left side has a disease. You can see the eardrum and the malleus bone is pushed medially into the middle ear structure. On the right side, yeah, right there is the tympanum is pushed in, and you can see the growth on the left ear canal pretty easily. It's all the way. It's all the right. It's even bigger. Yep, right there. Yep, right. All that is growth, right, penetrating into the middle ear. On the right side, the ear canal is normal. What we are looking at mainly when we see the ear CT is, number one is the bony structure, number two the air's flow in the middle ear. So middle ear is all filled with the air, and anytime there is a problem, the air gets replaced by either tissues, either fluid, either bony structure, or the tumor, something that fills up. So you want to look at the air positioning in the middle ear. So the next one is going to be, so here is this is a very typical image of a cholesteatoma. Cholesteatoma is a growth that starts from the skin, penetrates into the eardrum, and the skin keeps growing in the middle ear. And right where it is showing, you can see the structure of and yeah, right there is the bone. Bony destruction is a characteristic of cholesteatoma. So there is a lot of bony lysis going on. Bone gets very destroyed from the osteolytic chemicals from cholesteatoma. So next one is another example of cholesteatoma. You can see it has invaded the middle ear a lot. This is uneven growth, so you can see some of the air-filled cavity in there. And cholesteatoma has a very strong odor. You can see the bone also, how much the bone has been distracted from the osteolytic chemicals. So the next one is.
Well, that was the last of the slides.
Okay.
We'll now start looking at CT scans themselves.
Okay, so we are going to the CT scan itself.
And now we're going back, Dr. Kureshi, to a normal anatomy with no significant, no pathology. And maybe you can describe the anatomy one more time so we are oriented.
Okay, so this is a feline CT. Feline has two chambers, middle ear and then the bulla. So the bulla is a big structure where the cursor is. Right between the middle ear and the bulla on the top area, there's a connection. There's a very small, right there. Yes, so the bulla and middle ear is connected in front of the promontory, the round structure right in the middle ear, right there is a promontory, and right in front of the promontory, there's a connection between the bulla and the middle ear structure. If you look at the bulla, the bony structure of the bulla is all smooth. So bulla and middle ear structure is all lined with the mucosal layer. And whenever there is a problem, the mucosa gets inflamed. So you will see the inflamed mucosa, and the inflamed mucosa start building up the mucus in the middle ear. So we'll see that middle ear mucosal inflammation and the fluid buildup. So this is a very, very good example of normal CT. We are going to look at the ossicular chain. Right there is a malleus, that little bit arrow right on top of the cursor right there. Malleus is connected to the incus. So the incus head is the axial view is probably going to get, yeah. So the dark white structure you see is the incus right in the epitympanic recess, a little bit higher up. So that's the malleus. Malleus is connected. You follow the malleus up dorsally. And the bright white structure, okay, so it's...
We're going the other way.
Yeah, other way, there you go. So the white structure is an incus, body of the incus. Incus is connected to the malleus, and long axis is connected to the stapes. That is a round window, and right dorsally is the oval window. Right there, yes. That's the oval window right there. And then you can see the cochlea, the screw-like structure. When you scroll up and down, you can see the cochlear turn. There is 2.5 cochlear turn. Right now you're looking at the basilar turn, and now it's a 2.5 turn of cochlea. Cochlea is very important because you want to look at the structure. Is there any extra fluid in there? Is there extra bone in there? That is what is going to cause the hearing problem. Cochlea is also connected to semicircular canals. And if you scroll a little bit, you will see the 3 semicircular ear canals in there. Scroll a little bit. Probably go the other way. A little bit more. Right there, there's 2 semicircular ear canal. You can see between. It's not very clear still. Scroll a little bit.
Further up.
There is one is right left to the cursor.
Right here.
The dark one. The dark kind of, yeah, it looks like a rabbit ear. Mm-hmm. So there is 3 semicircular ear canal that you are going to see. In cats, when you're looking at the ear CT, you also want to look at the eustachian tube that goes into the nasal pharynx. In cats, it's extremely difficult, but David is going to try and see how far we can follow the eustachian tube. So on the dorsal aspect, right, that black area that's jutting out was the, so okay, I'll stop right there. Here is a 3 semicircular ear canal on the, yeah, right there, 1, 2, and 3.
Uh-huh. Okay, they're pretty large then. They're
yeah, they are pretty large.
Okay. And the eustachian tube is a little harder to see.
It's very harder. In the dog, we will see that a little bit better. So if somebody wants to practice seeing feline eustachian tube, which is extremely difficult, but if you look right there, yeah, that is the left one. Yeah,
And
there, right, yeah, right there. If you follow it, you will see it opening up in the nasopharynx.
And it tends to be a virtual space. So if I understand this, it's not truly a space, so it's not showing dark on the CT scan.
Right.
It will
And
be soft tissue because it's collapsed.
And eustachian tube has a peristaltic movement, so when it is closed, you generally don't get to see it very well.
Okay.
On the left side, the round circle. No, on where you were, where the semicircular. Yeah, right. Go a little bit left, Right, yeah, right there. That's the carotid artery right there.
Okay.
Internal branch of carotid artery.
Important branch, I suppose, to stay away from when you do a surgery.
Absolutely, if you don't want to get into trouble, yes.
So it doesn't take much. It's right behind the chain. Yeah, very delicate area. Yeah. Okay, that's a very interesting case. What we'll do now is we'll switch to another case, if that's okay with you.
Yeah, yes. Let's go to the next.
So this is the VetCAT software. It would be very much like you'd see it on the machine itself.
Okay, so this is a canine. It's a very good CT to study. So here you can see the eustachian tube right on the dorsal aspect of middle ear space, right there. Yeah. If you follow that scroll, you can follow that line. Keep
here.
Scrolling. Yeah, keep scrolling. It will go all the way. We might want to pull the. Yeah, there. Okay. Keep scrolling. And then there it is. There is a tube right there. It is very thin. So the 1/3 of the eustachian tube towards the middle ear is a bony canal. 2/3 towards the middle ear, towards the nasopharynx is the cartilaginous eustachian tube. And the most important thing here is you want to look at some growth, some obstruction in the nasopharynx. Quite often, the eustachian tube is blocked, and that creates a lot of problems in the middle ear. Middle ear is designed to drain the mucosal mucus, and it also allows the air to go in and out. So you want to look at any blockage on the eustachian tube will make a lot of sense. Okay, looking at the right middle ear, there is a lot of pathology.
On the axial view, yes.
Yeah, the right side has a lot of pathology going on. There is a lot of, so if we scroll out of there, a little bit, there is a lot of thickening of the mucosa on the bulla. If you scroll, yeah, right there, that is very thickened, but if you go, yeah, right there, there's a lot of thickening of the mucosal layer. And David, can you change that setting and see if that makes it, yeah.
We can change the contrast.
Perfect. And if you scroll out, you can see still the mucosal layer it changes. If you scroll up and down, there you go. You can see how it is lined up on the bulla surface. Very significant. This dog had foxtail that penetrate through the tympanum into the middle ear, and this is all outcome. Years and years down the road, this is what is happening. Okay, so let's go to the next one. What we are looking at here is bilateral cholesteatoma. Cholesteatoma is considered to be a very rare disease until you have a CT and you start looking for it. You find them a lot more than what it is reported in the literature. Cholesteatoma, again, is growth from the ear canal skin, growth from the squamous epithelial from the tympanum going into the middle ear. And the characteristic right here is so much bone is so distracted right there. There's a lot of distraction of the bone. The interesting thing here is the cochlea is absolutely normal in this dog, which is going to have some effect somewhere. But the tegmen tympani, which is a bone between the middle ear and the brain, and here on the right side, the tegmen is pretty much impaired. There's a connection between the middle ear and the brain. So the protection for the brain in this dog right now is just a dura that is holding the bacterial infection going into the brain. Very, very serious condition. Cholesteatoma is notorious about causing a lot of bony distraction like that.
Interesting. Okay, we'll go to the next case.
Yeah. So here, so three things you can identify very well on the CT. One is the changes in the bone. Second one is the growth in the middle ear. And the third is the fluid. So you can see in this case, you can see on the coronal view on the right side, the fluid lining is, you can see it's a fluid, it's not any tissues. It's a concave structure right there that tells you that this is fluid, it's not any tissue. So this dog has a lot of middle ear effusion, and that is building up in the bulla. It's very, very easy to identify, very easy to diagnose. The thing, if somebody is interested in doing more ear CTs, it's important to diagnose and identify the pathology, and you need to figure out what causes that pathology and how you are going to be able to approach. But if you are just looking for some ear pathology on CT, three things. Look for the bony changes, look for the fluid or tissue, inflammation of the mucous lining, and the growth. Sometimes the growth is uneven. You can see some lumps and bumps just like you see on the skin or any other part of the body. So that's basically what the CT is right now as a very basic introduction. But if you get more into that, you will find, and it's amazing, once you start seeing things, you wonder what you were missing. It's very, very mind-boggling.
Very, very interesting, Dr. Kureshi. Thank you very much for this quick overview. I know you've spent years studying ear anatomy and approaching it surgically. There's a lot more to say, and it looks like the availability of the CT scan with high resolution has allowed you to diagnose this more precisely and approach these cases probably surgically a little differently than what you used to do.
Absolutely.
Yes, and I just have, I see some questions here. One of the questions is, how are you using the CT scan for follow-up imaging? So after the procedure, are you interested in taking a CT scan maybe several months after the surgery, and what are you looking for at that point?
So it is a very difficult question to answer because each condition is different. The middle ear structure is, in my opinion, in a medium-sized dog, is about the size of olive. And that has over a couple hundred anatomy, and which anatomy is involved, that's very difficult. And the funny thing is cholesteatoma, talking about just one example, You can have 10 dogs with cholesteatoma, and all 10 dogs are going to respond completely differently. Some cholesteatoma is going to be very aggressive, some is not. Some you do 1 surgery, some you do 10 surgeries. So it all depends on how the dog is responding, and that determines how often or how frequently I want to look at. Now, ear condition and ear diseases is when you are treating it, it's a marriage between CT and endoscope. So you have to put both information together and decide how often you will need to do the CT.
Thank you, thank you. And are you, another question here that I see from one of our viewers. Are you able to use imaging differently than you used to in terms of following up on a non-surgical cases, or how is your approach now in terms of procedures? You watch those pathologies and treat them maybe with medication first, or what's how do you go about this particular approach?
So again, the ear is very complex. When it develops a disease, what happens is when there is a chronic problem in the ear, it is not much different than somebody smoking cigarette. So initially, the person will cough because of some irritation. If the person doesn't stop, the coughing gets worse. If the person still doesn't stop, the lung tissues are going to say, wait a minute, I'm going to solve my problem on my own. And that lung turns into emphysema just to protect it from the smoke. The tissues in the ear does the same thing. They go through transformation. And once there is a transformation, it is very difficult to change those tissues back to where they should be. So talking about the best thing to do with the ear disease is don't let it happen. You want to stop it in the beginning. If a dog comes in with an ear problem, do the CT, figure out if the middle ear is involved or not. If the middle ear is involved, plan your approach treatment accordingly. If the middle ear is not involved, you have to be very aggressive with debriding the material that builds up, because that causes more chronic problem down the road.
Thank you, thank you. That's very interesting. It seems to me that the dental users of our of CT scan come across, like I think you said earlier, come across a lot of ear disease incidentally. They're looking for dental disease, and there's quite a bit of ear disease as well. And it seems to me that the presentation that you gave today, and at least the anatomy and some of the major pathologies are something we have to watch for while we're looking at other parts of the maxillofacial complex. So I want to thank you very much for your time.
My pleasure.
It's been, for me, it's been a pleasure and an honor to watch and learn from you over time, and see what you're able to do with this treatment of the ear in general, and in particular since you've been able to use high-resolution CT as an addition to your practice. So I want to thank you again for taking the time to review this with us, and this webinar will be available for access in the future, so people will be able to go back to your explanation at their own pace. Thank you very much, and I thank every one of you to join us tonight. Thank you.
Thank you. Good night.
Good night.